All right, so the next thing we're going to do in our how to read bodies and how things affect other things set of videos is to look at what happens when the knee is moved around and how it affects the rest of the body. Right now, what we can say about Stephanie, who's wonderful, is that her knees are a little hyperextended. They're a little locked backwards in space, right? And that traditionally is going to cause a slight anterior rotation of the pelvis and a slight posterior tilt of the rib cage and a little bit of a head forward thing. So before I change anything at all, I just want everybody to sort of mentally know where all the different parts are. And I'm gonna loosen her knees. And I want you to see, for you, Stephanie, I just want you to try and stay easily balanced on your feet with your eyes forward. So, come into your toes a little bit. Yeah, there we go. And so this is an extreme bend. I wouldn't want her. This is not neutral. This is way past neutral. But that tilted the top of the rib cage forward more once I asked her to make sure that her toes were contacting the floor. If I bring this back and then really lock it back, notice the different changes that happen up top, right? Some of those might be good or bad depending on the client, right? But if the knees are super locked into position, which for Stephanie they tend to be, that's going to cause a lot of tension up here, right? So a very subtle shift here allows all this to lighten up top, and it actually drops her shoulders a little bit. I don't know if you saw that on camera over there, but I can see it over here, a little bit of a do you feel a shoulder drop? Yeah. Okay. Now, what I'm going to do is ask her to stand neutral again like she normally does, or what's really hyperextended. And now I'm just going to move one knee forward. So if one knee shifts, then we get to see this rotation again, right? And this is a very extreme version of that. But a subtle version is still going to cause this pelvic rotation here, this counter rotation up here, and some tension in the neck to bring the eyes forward to be able to talk in front as opposed to just look over there, right? So if I bring this back, that evens out. So if you're noticing one knee that's locked and one's not locked, that's going to cause a spiral throughout the body that will pile up through all of the different joints. So really any client that comes in complaining about anything, if you see that mismatch of one knee locked, one knee bent, really everything else in the body is going to be affected by that. So even though the client came in complaining about their neck or shoulders or back, if I don't do some work at some point in the series to even out the two knees and bring them more towards a neutral position, none of the work I do up here is really going to stick around. It's always just going to return to her normal. All right, one more thing. This is going to be a little bit harder to try to show, but I want to try to show what happens if somebody's knock-kneed or if they're bow-legged, right? And so I'm going to try and bow your knees out. I don't know if they're going to go there. So let's do something like that. All right, and that will affect the ankles for sure, right? And so this happening up here is going to cause the ankles to supinate, and that's going to affect the rest of everything as well. Now the converse, if I were to really lock your knees together, where do you feel that? I'm guessing right in the mid-back. Yeah. Yep. And so again, if somebody's really complaining about low or mid-back pain, you want to make sure that this is more neutral in order to get that to let go. Certainly I'm going to work on the low back muscles, I'm going to work on the glutes and the hip sockets, but I'm going to absolutely do quads and adductors, because if I can't place this knee into a neutral position, the pelvis and the back and the ribs are never going to be comfortable going into a neutral position either. Same thing in side view. So here we absolutely can see the sense of a hyperextended or overly locked knee. And what we see along with that is a slight anterior pelvic tilt, a definite posterior rib cage tilt, and a little bit of head forward. If I take these knees and start to bend them, and I want you to really sink into your feet, this does start to open up a little bit and become a possibility of something more like that, right? And now if I just bring these not all the way back, but almost all the way back, I want you to feel your weight in your toes as well as your heels. Great, there we go. Now we got a nice easy lineup of everything. This is a little easier for sure. Cool. So now I want to do the bow-legged and knock-kneed example as well, because you'll see a lot of how it affects up here. So if we take these knees way out, as far as you can comfortably be without falling, we really can see a back bend coming in, and you, I'm guessing, can really feel these engaged a lot, right? Okay, so let's bring that back to neutral. And now we're gonna try and roll these knees in and touch them together almost. And that changes things differently, where we've now almost got a two tucked pelvis, meaning posteriorly tucked. There's a little bit going on here, but to me, most of the tension comes into the front of your neck. I don't know if that tracks with how you're feeling.
Yeah.
Cool. All right, so now soften it all up and relax. And for you specifically, not for every client, I'm gonna say just let yourself have a very subtle, tiny knee bend. Yeah. And try to find what that feels like in terms of everything else. Balance. Yeah, there we go.